expected approval on December the 2nd. We have an opportunity for you to participate today. However, you have until November the 23rd to submit written testimony. One of the things that we are trying to avoid is to have a lengthy discussion back and forth. So if you don't see us responding to some of your comments, it's only because we're trying to get everyone in within an appropriate time frame. The blueprint is designed to provide us with just what it says, a blueprint for the overall performance of our students in our school system that would really last a 10-year plan. And so it is a draft plan. This plan may be changed or augmented in some form or fashion, but it's not our intent to readily change the plan. We are to implement the plan. We want to make certain that the plan is effective, that it succeeds, and it obtains the goals that I think the original sponsors had indicated for us. With that in mind, it is clear that our task is to determine what this plan will look like, what it must do. It would also provide us the time frame for when this should be done and the expected outcomes. The how of all of this is really left to the local boards and the State Board of Education. We have a number of speakers to provide input for us today. And as I said before, we are here to listen to you, but more importantly, you have an opportunity to send even additional testimony in by the 23rd. So with that, I'm going to turn it over to Rachel to explain the process that we're going to follow today. Rachel?
All right, thank you, Mr. Chair. So we're going to follow the same process as we did this afternoon. When your name is called, please turn on your camera and unmute yourself. You will have 3 minutes to speak. We will provide you with 30-second notification in the chat when you have 30 seconds left, and then also when your time is up. And we would
please indicate who from the board is with us tonight, please.
Sure. We have, of course, yourself, Vice Chair Kerwin, Dr. Lynch, Dr. Doss, Dr. Stapleton, and Mr. Manco.
Okay, thank you. Let's get started.
All right. So we have a panel, and the first speaker, it's an early childhood panel, and the first speaker is Carolina Reyes.
Hi, everyone. Thank you for allowing me to be here. Can you hear me well?
Yes, we can. Thanks.
Well, buenas tardes. I'm an immigrant and Latina. I am very pleased to be here and to be able to provide some feedback. And I thought I was not going to make it because my asthma has been very bad and I had to go to the emergency room. But it's so important for me to be able to say what I wanted to say, that I am taking the time to do it. I am an owner and I am a director. I am a teacher. I'm an advocate of early childhood education. And I also think that the blueprint is a great idea for our families, so that way they can have access to early childhood education in quality settings. My suggestions will be, I know that he said that you are working towards to be effective and to be able to succeed. But I think in order for us to do that, we really need to pay attention to the mixed delivery idea that you are touching on. I study a little bit the draft, and one of the things that I just wanted to point out is that in order, in my opinion, to be a strong mixed delivery system, this has to be inclusive of the child care community in the inputs of the implementation of this law. I believe strongly that when this happened, many of us, maybe we were not invited to the table, but I think that what we can offer as family and centered childcare is so much. We are able to communicate with our families more one-on-one. We are able to empower our families to be able to give them what they need and the tools they need for the children to be ready for kindergarten. But when we look at pillar 1, objective 1, letter B, and we talk about communication and outreach, I clearly saw that the family and the child care centers are not included in those standards and those little points. And I think that we are the ones who are working with the family. We are the ones who are with them, and we can be able to do that. I will also talk about that the money that we are acquiring for us to be able to be part of it is not enough to be able to cover salaries that will compare with the public school system. So that is one barrier for us. I will also add that a lot of us in the field believe that the social emotional foundation for early learning is essential. I know that Maryland would love to have many kids to be ready to go to kindergarten, but what is ready? What does that mean? What it really means? And I will say that all 4 areas of development, we really need to please put a lot of attention to the social and emotional foundation of our children. I will also add that you need us. You need private centers and family centers for this idea to be successful. I don't think that you have the infrastructure to be able to accommodate all the 3 years old, all the 4 years old that Maryland has in our state. I will also add that right now we feel there are so many barriers. We are at a beautiful and diverse Maryland state. We have teachers like me and many others who work in this field with higher degrees, with bachelor's and master's degree, that they are aware of what it means to work with children. They are aware what it means to be able to have a child ready to start kindergarten. Please don't left us out. Right now, with what we have is not enough for us to be included. We need a system to be able to write grants. Grant writing is difficult, it's time consuming, and I am very sure that a lot of my colleagues who had already applied and they were not able to be part of it is because they were missing vocabulary and they were missing certain things that we are not aware of. We need the assistance of MSDE to provide us coaching and mentoring for us to be able to be part of it. This is the only way that I think that this can be a truly mixed delivery system. We also need to be included at the feedback station. Right now, I would love to know who is representing the childcare community and the work group for feedbacks. Do we have any? I'm not sure.
Excuse me. Thank you so much. Your time
is up. I was looking at the chat. I didn't.
That's all right. That's all right.
Okay.
You're welcome to submit written testimony too.
Sure. My question is, are you going to ask question at the end or no?
No, we do not plan to ask questions tonight. We have too many speakers. It's been a long day, but there may be some follow-up from the staff to go back to you about some additional comments. But please, you have up until the 23rd of this month to provide any additional comments. Thank you.
Thank you. Gracias.
Next is Bill Hudson.
Good evening, everyone. Thank you for the opportunity to address the board tonight. My name is Bill Hudson. I am the Executive Director for the Family Child Care Alliance of Maryland. For the 3rd year in a row, the Alliance has broken the state record for engaging family child care in Maryland's mixed delivery system. This year, we have 27 family child care providers delivering pre-K instruction as part of the pre-K expansion grant program. We have another 30 working towards degrees and/or P3 certification with the goal of joining the pre-K system. Having said that, I'm worried that trend might not continue as a result of potential unintended consequences of issuing waivers to the LEAs. As some of my colleagues will talk about tonight, I think, there are significant obstacles for community-based partners to build the supply of qualified teachers in both centers and family childcare. As a result, it's going to take us several years to build the capacity to serve what is allocated as our portion of eligible children in a given county. I'm sympathetic to the fact that many LEAs may feel the need to apply for waivers to serve more children because of the lack of community-based spaces in their districts. If that happens and they build the extra capacity, I'm deeply concerned those actions will dampen the incentive for community-based partners to expand existing programs or open new ones. In the worst case scenario, LEA expansion as a result of waivers could cause many community-based partners to close completely. That'll have a cascading impact of reducing available spaces for both pre-K and childcare for children under 3. One of the many lessons of the pandemic is the fact that childcare is essential to working families. Just 2 days ago, Fortune Online magazine ran an article that spoke to the potential collapse of the childcare marketplace under the current conditions. As we collectively work to implement the blueprint, I respectfully request that you give serious consideration to the impact of waivers on the childcare marketplace and the devastating impact they could have for children and families across the state if not implemented with care. And that concludes my remarks, and thank you for the time.
Thank you very much for your testimony.
Lisa, I'm going to let you pronounce your last name.
Thank you. Good evening. My name is Dr. Lisa Bushy. I'm pleased to share comments on Pillar 1 tonight. My company owns and operates 2 early education and care centers in Anne Arundel County. Both centers are MSDE accredited and rated level 5 in Maryland Excels. We happily jumped on board the opportunity to offer community-based public pre-K to eligible children beginning in 2015. And we offered grant-funded public pre-K for 6 years, culminating last school year in 2 classrooms of 40 students total participating in the pre-K expansion program. Unfortunately, we declined to apply for the grant this school year due to difficulty finding qualified teachers. For the 21-22 school year, we employed a teacher who holds a master's degree in early childhood education from Towson University. However, she was considered not qualified to be the teacher of record in the grant classroom going forward because she didn't hold certification. She was unable to find an alternative pathway to certification that met her needs. Despite advertising for 6 months, we were not able to find a certified teacher for the program by the spring of 2022. We felt the risk of potentially losing the grant funding in July, when we would have already enrolled up to 40 children whose families would be depending on us, was too great. And sadly, we decided not to apply. This resulted in us turning away many eligible children and families who knew about our previous community-based public pre-K, and they would likely not be able to afford private preschool. So in my experience, the greatest barrier to participation in community-based pre-K is finding a teacher who meets the qualifications. Greater emphasis on equitable, fully funded alternative pathways and supports that meet the needs of early childhood professionals currently working in the field is needed. This means considering multiple entry points. Early childhood professionals may be starting with a high school diploma, an AA degree, or a bachelor's or master's degree. Each of these professionals needs a pathway to certification if we are to meet the demand for teachers. Some examples of needed pathways and supports include apprenticeships, competency-based education models, stackable and portable coursework and credits, coursework that meets the needs of teachers whose primary language is not English, remedial coursework for those who need it prior to enrolling in college-level courses, and coaching and support to ensure persistence in higher education. The early childhood education field needs bold and innovative approaches to address the workforce crisis. I respectfully request that we consider including language in Pillar 1 that mandates the development of innovative approaches to certification that also meet the needs of emerging students to ensure that the vision of a mixed delivery system is realized, and that further degradation of the childcare infrastructure is averted. That concludes my remarks.
Thank you.
Christina Push.
Sorry, I was trying to come off a video. Thanks, Rachel. Great. I'm Christina Push, Executive Director of the Maryland State Child Care Association, and we thank you for your hard work in incorporating suggestions from stakeholders Blueprint Pillar 1 has many important goals, including substantial increase in the supply of early childhood education teachers, funding for both public and community-based pre-K, and measurables, including reducing or eliminating the achievement gaps. MSCC is concerned as the blueprint, especially related to Pillar 1, is implemented and we are still recovering from a pandemic. We are all struggling with critical workforce shortages. Public schools are making adjustments to qualifications and soliciting any way they can to fill teacher shortages. Childcare is also struggling. Maryland lost over 800 childcare programs since 2020, and although many jobs have recovered, childcare has lagged behind nationally. Maryland is second highest in the country for loss of childcare jobs and an alarming 25.5%, according to the June 2020 jobs report. If more licensed childcare businesses close due to the loss of 4s and low-income 3s because we cannot compete with the public schools in the pre-K arena for teachers, how will this impact the goals to increase supply of teachers and reduce achievement gaps when infants and toddlers, 2s and some 3-year-olds will have less access to high-quality childcare, be forced into unlicensed or informal care, which is proven to have poor kindergarten readiness outcomes? We are already losing our teachers to Amazon and Target, to DC, paying $15,000 bonuses in parity with public pre-K and no certification requirements. More unintended consequences will include higher infant toddler tuition rates, and parents barely can afford and access that now. We've lost our kindergartners when preschool for all rolled out, and we pivoted the best we could. However, many will not survive without their 3 and 4-year-olds. We applaud the goals for mixed delivery, and you say you need us to reach the goals. However, there were only 90 applicants for the pre-K grants, and of the 90, only 30 awarded. This number doesn't come close to meeting the 70-30 minimum split for pre-K delivery. Barriers include teacher certification requirements, lack of equitable alternative pathway to certification for community providers, lack of resources to successfully write for and administer very complex pre-K grants, and funding flaws. We need at least 10 children to break even financially in centers. The interesting data from MSD is that we already meet numerous requirements for Pillar 1. Maryland Excels reports there are 1,283 level 3, 4, and 5 programs, which is plenty to meet 70-30 split. Additionally, according to MSD's database, 1,993 childcare teachers have bachelor's degrees, 403 have master's degrees, 14 have doctorates, and 66 have foreign degrees. We should easily be able to meet the mixed delivery goals and avoid waivers, which will become the norm, but cannot if we don't make equitable changes, including expanding and creating provisional alternative pathways and timelines to achieve certification, alignment of the current credentialing system with college credit, recognition of respective competencies and work experience, and sustainable funding formulas to be competitive. We should look at other states as they adjust and consider essential childcare community. This year, Boston UPK will launch a new per classroom funding formula to ensure high quality learning environments. Providing per classroom instead of per pupil funding will provide stability for childcare providers who have been greatly impacted by COVID. That's my remarks for this evening. Thank you.
Thank you so very much.
Randy Albertson.
Hi, good evening. I'm Randy Albertson. I own Innovations in Education, LLC. We support community-based childcare programs through professional development and consulting services. Part of what we do is offer support and grant management services to programs that have been participating in pre-K expansion grants and blueprint grants. What I'd like to do tonight is share my experience working with grant recipients and some of the challenges that have arisen over the years in implementing these grants. First is an issue of funding. Right now, the grant is flat funded with a per child rate across the state. No other early childhood program is flat funded. When we look at state scholarship, it is not flat funded because cost of living and cost of operating a business varies across the state. The total cost of quality childcare has not been taken into account based on these differentials. The amount that might fully fund a program in Western Maryland will probably not break even for a program in the central part of the state, yet both programs receive the same dollar amount per slot. To add insult to injury, the parameters of the grant specify that if a program is not 85% enrolled by December 31st, funding will be diminished by the number of unfulfilled slots. This is a burdensome penalty placed on community providers. It's my understanding that funding for public schools is not reduced if their enrollment targets are not met. So why are community providers penalized for this? A program that applies for the grant in good faith and commits to hold open childcare slots for income eligible children will incur the same fixed operating costs, regardless of whether they're fully enrolled or not. The cost they have, regardless of enrollment, salary and benefits for lead and assistant teachers, rent, facilities, maintenance costs, water, gas, electric, does not matter how many children are enrolled. They've held these slots and they're being penalized if those slots remain unfilled. The grant stipulates that MSDE will provide support with recruitment to help community-based programs fill those slots. However, in my experience, the only support MSDE has provided has been to suggest talking with the LEA or putting flyers up in the community. For a program that has already taken these steps and paid for advertising and reached out to as many community partners as possible to spread the word, yet they're still unable to find eligible children to enroll, they're not receiving additional support from MSDE. They're only penalized and losing money that they have relied on. Additionally, to the costs associated with the grant that's not accounted for are with regards to teacher certification. To begin with, finding a certified teacher is a challenge everywhere. I teach early childhood education at the University of Maryland College Park in the School of Education. For the past 2 years, the capacity of incoming students for my class has been 25, and yet I've had 12 or fewer students enrolled. People just are not going into this field. The challenge for community providers, if they find and hire a state certified teacher, the cost to maintain that certification can be prohibitive. Maryland requires a minimum of 6 credit hours every 5 years to maintain a teaching certificate. If you work in a public school system, much of that cost is covered. For community-based programs, that burden falls to the individual teacher. There are cost options out there to pay for it, but the bigger challenge is when you work in a childcare center, you're required to take a minimum of 12 hours of Core of Knowledge training each calendar year. If you're participating in the Maryland Childcare Credential Program, which you need to do if you're part of Excels in accreditation, which means your program is eligible for this grant, the teacher needs 24 hours of Core of Knowledge training every calendar year. The certification branch at MSDE does not recognize these Core of Knowledge training hours and will not apply them towards certification renewal. So now you're asking a pre-K teacher in a community program to take 120 clock hours of Core of Knowledge training in a 5-year period, plus the additional 6 credit hours, which is the equivalent of an additional 90 hours of coursework in a 5-year period. No money has been set aside to pay for any of that training. The MSDE credential vouchers will cover part of the cost of that training, but most of the burden falls to the teacher of the child care program. I've been an MSDE approved trainer for over 25 years. In that time, I've had to jump through hoops every time I want to offer a new workshop. Every PowerPoint, handout, resource, the training methods that I use have to be vetted by MSDE for each and every workshop I submit. My lesson plans, my assessments, everything for every workshop is reviewed by MSDE. I've written hundreds of hours of training over the years, and everything has been scrutinized. I taught for 4 years at Howard Community College and for 2 years now at University of Maryland College Park. No one reviews my lesson plans. No one reviews my assessments. I have much more autonomy teaching at the college level than I do teaching those Core of Knowledge required training hours to the community programs. It's unclear to me how this is an equitable system for professional development when my Core of Knowledge workshops are put under a microscope for review, but they're not considered worthy enough to count towards certification requirements. Thank you for your time.
Thank you.
Diane Span.
Good evening.
Hi.
Hello. My name is Dr. Span. I am the CEO of ABBA Education. It's a 501(c)(3). And what we do, we partner with schools to develop community school approaches, particularly as it relates to Pillar 1 and 2, where we are working with developing academic rigor in the curriculum and also developing teachers. To give you a framework for where I'm coming from, my day job, my daily day job is working in a middle school. And I am the I'm the chair of the design department, and I teach technology, media, and design. My passion comes from working with 21st century community learning center programs. I have over 13 years of experience there. Prior to that, I was teaching math. My focus was, okay, let's get our students proficient in math as a way to build equity and to give them access to certain things in our society. And what I found after 13 plus years is that giving just the math, just the science, just the core, without giving the ability for students to reimagine what they can do with this as it relates to using art to push forward some of their propensity to do things artistically. I was amazed as I looked at students and they would be doodling and seeing some of the amazing artwork, or looking at students that were what you would consider very quiet or not very outgoing, and seeing how through the use of art, they were able to come out of a shell, to be more confident. And so what I'm here tonight to advocate for is to look at how we can maybe reimagine what is happening in the schools itself, and the propensity of, looking at standardized tests for just math and reading, and those, we absolutely need that. However, looking at what our kids need now, coming back from 2 years, missing 2 years in school, having the social, emotional needs that we are working with as teachers with our students. What I find is that giving them the ability to, as is spoken very, very well in the research from Harvard project, Harvard, developing agency. And what that speaks to is that there are 3 different components of developing agency for children. One of them is motivation, the other one is skill, and the other one is opportunity. And when you bring those 3 together, particularly with the arts and things that they are motivated to do, that is when you're able to see the magic that needs to be happening in schools. So right now I'm working with my school to develop advisory types of programs where students are able to be motivated to do different things during the school time. I'm sorry.
I think your time has expired, I believe. So let me make sure.
Okay.
Yeah.
Okay. So thank you very much. I would just want to encourage the reimagining of work in schools. And I think you said that I can submit a written.
Right, by the 23rd of November. Yes.
Okay. Thank you.
Thank you.
Nikki Ham.
Good afternoon or good evening. I apologize. I was trying to come off mute, so I apologize that it took me a little bit longer. Thank you for this evening. Thank you for this opportunity. Good evening. Thank you so much, Chair, and the members of the AIB for the opportunity to speak to you tonight. My name is Nikki Ham, and I represent over 1,000 members of the Maryland School Counselor Association. And we appreciate the opportunity to bring feedback on the Accountability and Implementation Board's draft plan. Many of you have heard the term guidance counselor, or you may have had a guidance counselor when you were in school. Well, we really have transitioned from this term to being school counselors. And as school counselors, we are trained to provide social emotional support to every student. We do so much more than help with college applications and assist with schedule changes. Today's school counselors provide short-term solution-focused counseling in schools to students in either a group setting, an individual setting, or through classroom lessons. School counselors consult with educators about the social emotional needs of students, and most importantly, they partner with families to identify much needed community resources, especially around issues of anxiety, trauma, school phobia. So the general counsel has tasked you, the AIB, with a lot of responsibility. And we recognize that. We get a lot of responsibility too in our role. And we recognize the amount of effort it took to develop this draft plan in such a short time frame. And we strongly support the AIB, including school counselors' ratios and membership on the Consortium on Coordinated Community Supports as implementation considerations under Pillar 4. We do have a few other suggestions that we believe could build on these provisions and help ensure that all Maryland students receive the world-class education promised by the blueprint. The Commission on Innovation and Excellence in Education's 2019 adopted in the national recommended ratio of 250 students per one school counselor. However, per MSDE data, many of our counties are significantly above the recommended ratio, with some counties having over 900 students, 900 per counselor. Additional, school counselors are frequently tasked with performing administrative duties such as managing class schedules, doing lunch duty, a number of different things. And although school counselors are always willing to support the needs of their school, these administrative duties do reduce the time that school counselors have to spend doing our core responsibility, which is really supporting students, removing the social emotional barriers that impede a student's ability to be academically successful. Therefore, in thinking about monitoring ideal ratios, it would make sense to monitor if school counselors are being provided with the time to meet MSDE's recommendation that school counselors spend 80% of their time doing direct services, such as individual counseling, group counseling, classroom lessons. There are a few areas in the draft plan where MASCA, Maryland School Counselor Association, believes that would benefit from closer monitoring of school counselor ratios. So we're thinking about looking at, for example, the concentration of the 40% concentration of poverty schools, and how we spend our pupil per pupil funding at the county level, where they must submit a plan to the AIB. We suggest that the AIB require these plans to include school counselor ratios for each of the concentration of poverty schools. We also suggest that AIB require community schools needs assessments to include school counselor ratios. And although ultimately it will be up to the community schools to decide how they use their resources, we really believe that there's a benefit to there being some more guidance around some of the basic data a needs assessment should include. And one of those pieces of data points would be the provider ratios. In addition, one of the things that we were looking at is, or wanting to have some suggestion with, which is the guidance with in terms of consortium career ladder guidance under education article. Several professionals are excluded from the definition of a teacher under that guidance, that career ladder. And by extension from the Blueprint career ladder, the NBC initiatives, school counselors are not one of those that are excluded professions. Additionally, school counselors are the only school behavioral health providers that are eligible for certification as a national board certified teacher. So although we're not excluded directly, we are not included because we're not considered teachers. So there's been a confusion. 30 seconds are up.
Yeah.
All right. Thank you very much for your time.
Thank you.
Thank you. And last, but certainly not least, David Coleman.
Can you hear me?
Yes.
Yes.
Thank you. My name is Dave Coleman. I'm the CEO of the College Board. I think I may be the last speaker before your dinner, so I shall be brief. The College Board, as you know, reaches millions of students each year through things like the SAT, the PSAT, Advanced Placement, and Big Future. And we have a long track record of working together with you in Maryland with educators. But just as Maryland is changing, my conviction is that the College Board must change as well. The College Board must do everything it can after COVID in the face of the Maryland Blueprint to change the invitation for students. For years, high-performing students have benefited from AP classes, but the College Board needs to change so that AP is a meaningful and relevant option for the vast middle of high school students who are often disconnected. We need to change from seeing AP as a walled garden for some students and instead make it a broad invitation to all. That means we must start earlier in grade 10 with AP courses that are broadly interesting to a wider body of students and aligned with their career interests. The great issue of education, as all of you know, is not whether students take AP or dual credit or CTE, excellent work in grades 11 and 12. The same choke points constrain all these paths. Early college opportunities in particular only draw on those students who consider themselves college material. So what we have to do is make 10th grade a platform to propel many students forward who today don't consider themselves college material, that transform their experience. Let me give you 2 examples. AP Computer Science principals invite students to solve problems they're interested in, and it engages dramatically more young women, African American, and Hispanic students than traditional coding courses. Students who take AP CSP are 3 times more likely to major in computer science in college. AP Seminar lights up students because they get to do short research projects, work in teams, and present their findings, which of course are exactly the skills that employers are demanding. We have found that assessing student projects rather than just a one-time test unlocks a broader excellence. The AP score in this course now includes the independent scoring of projects. And these changes in these 2 courses mean that 80% of students in these courses in AP get a 3 or better, they get passing scores, and we find the lowest gaps between students from different backgrounds. I want to close by making something very clear. More AP is not always a good thing. That is not what we need from the blueprint. Completing 5 AP courses does increase students' chances of graduating colleges on time. But too many students feel pressure to take more than 5 AP exams. It's time to stop the madness. We need to protect the mental health of our students. We have therefore at the College Board eliminated all AP Scholar Awards that require more than 5 AP courses and have called on admissions officers to consider no more than 5 AP courses as evidence of rigorous coursework. The real work is to ensure a much wider range of students can take advanced courses in high school. The blueprint, I think, offers a remarkable opportunity, but that work must begin earlier than grades 11 and 12. We must engage students earlier. Thanks for your time today.
Thank you very much for the presentation.
Sir.
Sure,
Good luck.
that's all, Rachel? Is anyone that we missed that maybe still there? We can.
There was only one other person signed up who hasn't joined, but let me make sure. Eli Cohen.
All right. Thank you. Let me remind everyone that you have an opportunity to submit written testimony by November the 23rd. As I indicated earlier, our time frame is rather restricted because we have a final report that we approve by December the 2nd. Rachel, you may want to go through the timeline for everyone so that everyone's clear about the timeline frame and what we will be doing going forward.
Sure. So let me just say, if you would like to submit written testimony, just email it to aib@maryland.gov by November 23rd. The AIB has a meeting on next Thursday, November 17th, to discuss potential changes to the draft comprehensive plan, and then has a meeting on December 1st. And the intention is to adopt the initial blueprint comprehensive plan at that time.
Okay. All right. Is there anything from the fellow board members you'd like to say or comment on? If not, Thank you. And again, this session for today is adjourned, and I thank all of those who participated today. We look forward to working with you on the many questions and issues that you've raised, and many of you have raised some very serious questions. I will say that some of the things that were raised today are not necessarily all the things that are within the umbrella of the AIB, but many of them are items that we will pass on to the State Board of Education that I think that they obviously are participating in some degree with us today so that they can react to some of the comments and issues that were raised today. So it's a dual approach, and we have to decipher those that are geared toward us and that we have the ability to respond to, as well as pass those on to them to get comment and feedback from them as well. Anything else we need to do, Rachel?
No, sir.
All right. Thanks again. Good night.
Yeah, thank you, everyone.